Hey there, this is Dr. Osar, founder of Fitness Education Seminars and developer of the Integrated Movement System. Welcome to this edition of the specialist series for Fitness Insider, talking about thoracic rotation. Recall part 1 and part 2 of this series. First, we talk about the importance of creating a neutral alignment of the head over top of the thorax over top of the pelvis, and controlling this thoracolpelvic canister. And we talk about how we can get rotation from 3 ways. First, we can get rotation of the thoracolpelvic canister as a functional unit around the femoral head or around the hip joint. So we can get hip-specific rotation. We can also get thoracolpelvic canister rotation itself, or thoracic rotation, where we keep the pelvis stabilized and rotate the trunk and spine around the stable pelvis. And then we want to integrate both the thoracolpelvic canister, or that thoracic rotation, into hip rotation, into functional patterns, like our chop patterns, or our rotation patterns. So I'm going to show you examples of each of these 3 patterns so that you can see how to integrate this concept of improving rotation. Remember, the most important concept through this video series is, number 1, you want to achieve neutral alignment of the head and neck, the thorax, the spine, and the pelvis. We want to stack that thoracolpelvic canister over top of the base of support. That's the most important concept to achieving proper rotation. Next, we want to incorporate the principles of the integrated movement system, the ABCs, the fundamental ABCs, alignment, breathing, and control. Then we take that into the functional patterns of pushing, pulling, rotating, bending, squatting, lunging, and finally gait. So I'm going to show you how to incorporate the concept of thoracolpelvic canister rotation, hip rotation, and integration. So first we're going to look at hip rotation. So in this pattern, or these type of patterns, we're going to keep that thoracolpelvic canister neutral. So we're not going to rotate from the trunk and spine or the pelvis, but we're going to rotate the entire thoracolpelvic canister around that femoral head. So the femoral head and the lower extremity is the stable point, and we're moving that thoracolpelvic canister around that stable base. This really is a great pattern to teach the individual control of hip rotation, and also to accentuate that femoral head within the acetabulum as they're rotating, versus what most people are doing is they're not getting a lot of pure hip rotation and they're just rotating from the trunk and spine, or they're translating off to get rotation. They're not creating pure axial rotation through that femoral head, or pure femoral head acetabulum type rotation. So this pattern helps the individual learn how to control the pelvis moving around the femoral head, which is important for all our closed chain type activities, where the foot is in contact with the ground. So a very functional pattern, very great pattern to sort of get those hip rotators working and controlling that ability to move the pelvis independent of the femoral head. We'll do both external rotation as well as internal rotation. Our next group of patterns is now we're going to teach the individual how to stabilize their thoracolpelvic canister and then rotate from that trunk and spine. So for this pattern, we use the bench or a wall or a massage table so the individual can achieve a more neutral alignment. So what we have the client do is sit where they can get that pelvis. Remember from the last video series, we talked about the importance of the neutral pelvic position. So again, we want to stack that thoracolpelvic canister. The head looks straight forward, head and neck are neutral. The thorax is positioned over top of the pelvis. The pelvis is in that slight anterior pelvic tilt, because the slight anterior pelvic tilt is that neutral position of the pelvis. So I'm stacked up and I'm aligned. So the high sitting position is a great position because it teaches individuals how to get more neutral, how to centrate those femoral heads in the acetabulum, and then teach them how to sit and rotate. And again, so many of our clients sit for a living, but nobody ever teaches them how to sit and rotate. So what we do from here is now we grab a yoga block or a Pilates circle or a small light medicine ball, or if you don't have that, just hold the arms up in this position here. But this gives somebody the idea of creating a circle here. I want to stay nice and long, and then I'm going to have them rotate, imagining that axis through the center of the spine as far as they can control, and slowly come back to center. Rotate, and slowly come back to center. And what I'm checking for, what I'm monitoring for, is that they're not translating off that axis, that longitudinal axis straight through the top of the head, down through the center of the spine. So it's really teaching them how to control and get long to get their rotation, or get that length through the spine along with that neutral alignment to create more optimal rotation. And they perform repetitions to each side, and we're really monitoring their ability to keep that thorax stacked over top of the pelvis as they rotate. So again, we've gone over hip, pure hip rotation with keeping the neutral spine, trunk and spine, and thoracolpelvic canister. We talked about how to keep the pelvis neutral and then rotate the trunk and spine around that. Now we're going to teach you how to integrate that into a functional pattern. We're going to use a chop pattern, but again, the pattern is not as important as the concept. So again, I'm just going to grab a band. You can use a cable machine, you can use a dumbbell, you can use a medicine ball. And again, I want to teach the individual how to both rotate or incorporate that thoracolpelvic canister rotation as well as that hip rotation into this fundamental movement pattern. So again, I still want to maintain that nice long spine stacking up over top of their base of support with their feet. And as I chop down and rotate, I'm going to rotate through my hip, through my trunk and spine, and then finally extend out through my arms, and then come back, and then control the pattern back to the start. So I'm going to rotate, control, then rotate, come back. So I'm incorporating rotation through my entire spine, but not just randomly just chopping and doing it as aggressively, as fast and as far as I can. I'm teaching the client how to maintain control and then come back and control. Chop down and control, and then come back and control. It's all about teaching the individual how to maintain the optimal alignment, their breathing, and their control, working within the range of motion that they can control. Because when you control that range of motion, then the nervous system will allow them to develop greater range of motion. The more that the individual is allowed to stray off the ability to align, breathe, and control, the more the body's trying to reel it back in, trying to create tightness, to create that stability or that control it requires and needs for generating proper force and controlling force. So the more that you can teach them and focus on the fundamentals, alignment, breathing, and control, the more range of motion you can eventually create with your client. And that's what we talked about in the first video. You don't actually need to train rotation to get increased rotation. Yes, you need to train it at some point, but the most important concept is train the fundamentals, the principles, alignment, breathing, and control, and then as your nervous system generates more or feels safer in that ability to control its alignment, and it doesn't feel as much joint stress, it's going to start to let go of a lot of that compensation that we've all done to try to make up for the lack of optimal stability and or control. So I hope that makes sense. Teach neutral alignment, incorporate the fundamental ABCs, alignment, breathing, and control, and then work the client through the proper progressions that they best control. That's how you become a specialist. That's how you help your clients improve their rotation so that they can accomplish their health and fitness goals, get out of chronic tightness, get out of chronic discomfort, and start to feel better, move better, and start to exercise to help improve their quality of life. And that's really how you become that specialist that your clients need and want, as well as the individual that they refer their friends and family to. I hope you enjoyed this video series. Stay tuned to the next video series, part 4 of this video series, where we wrap all this up, add a couple more things to it, and I'll tell you about a really special program that we created to help you become that specialist your clients need, want, and will refer people to. Thanks so much. This is Dr. Osar with Fitness Insider and Fitness Education Seminars. Have a great day.